Hey everyone, this is Kay back again today with a respiratory related question. So we have a ventilated patient that develops refractory hypoxemia, bilateral ground glass appearance on chest x-ray and scattered crackles throughout. The PF ratio or the PO2 FiO2 ratio is 93. Which ventilator setting will improve oxygenation most? Here are your choices. A, tidal volume, B, FiO2, C, PEEP, D, rate, so increasing the respiratory rate. Take a moment and think about that. Well, if you said PEEP, which is C, you are absolutely correct. So when we talk about the need for PEEP, let's go back to this. Let's go back to this case study here. The patient develops refractory hypoxemia. What exactly does that mean? That means that as you are caring for this patient and you're going up and up and up and up on the patient's FiO2 because their pulse ox is bad news, you notice that even though you're going up and up and up on the FiO2, your patient's not improving that much. That's called refractory hypoxemia. Excuse me, I have a little bit of a dry throat here. And so that indicates that your patient has an intrapulmonary shunt going on. So we have refractory hypoxemia. So that means it is not responding to oxygen therapy. So upping the FiO2, that's not going to help, right? Because that helped you identify that there was a problem right from the get-go. Tidal volume, not going to be a whole lot of assistance here. And just going up on the rate on the ventilator, that's not going to be all that helpful either, because you correct a shunt with positive pressure. So again, refractory hypoxemia suggests to you that you have a right to left intrapulmonary shunt, which means blood is coming from the right side of the heart, going down to the lungs, never getting fully oxygenated, but yet coming back up to the left side of the heart without being fully oxygenated. That's a right to left intrapulmonary shunt. It's manifested at the bedside by refractory hypoxemia. We talked about what that is. You treat that then with PEEP. And that's the answer here. Another term that we see here is the term PF ratio. PF ratio is 93. Does that have any meaning to you at all, the PF ratio? Some people use it, some people don't use it. It's actually very easy to calculate. You're going to take the patient's PO2 and divide it by their FiO2. And remember that FiO2 is expressed in a percentage. So mathematically, when you divide by a number that's in percentage form, you have to first convert it to a decimal. And I always have my nursing school classes do this. When we talk about ARDS, I always have them take out their cell phones, which I almost never ask them to do, take out their cell phones. And I ask them to just take a stab in the dark here as to what their PO2 is. And they all say normal PO2 is, and they give me the normal value. And I say, just pick a number of what you think your PO2 is right now. Then you divide it by the FiO2, which is, well, in school, of course, it's room air, right? Which is 0.21. And I have the class all holler out what their numbers are. 486, 472, 4... that would be a normal PF ratio. Now here, this PF ratio is 93. And 93, anything less than 100 is considered to be severe ARDS. This patient is 93. Big intrapulmonary shunt going on, right? So all of these assessment parameters all come together to tell you that positive pressure is needed here. And, this patient's going to be tubed, but I just need to throw in that if we find that a patient has refractory hypoxemia and they're not intubated, we can go ahead and make a pit stop at BiPAP first and see if BiPAP's going to work for the patient. But more likely than not, the patient's going to be tubed and vented. So that's my story, and I'm sticking to it. A couple of things I want to mention before I close today. Number one, if you would like a CCRN mock exam, I just finished writing one. You can just check it out at CCRNchallenge.com, CCRNchallenge.com. It will ask for your email, and then it will send you my CCRN mock exam. 150 questions, plus the answers are there as well. The other thing I'd like to tell you about is my membership community. And I have come up with this membership community that's been a lot of fun, where I have a lot of different courses. My library is expanding every month as I add courses. I have courses in ICU drugs and hemodynamics, respiratory capnography, oxygenation, and ABG analysis. And I'm just now working on finishing up all the modules on my 12-lead EKG analysis. And I currently have the ischemia injury infarct module published and the bundle branch block one published, and axis deviation is coming out next week. So anyway, if you're interested, it's cheap enough, definitely $25 a month to get access to all of the courses and all of the CEs in my library. And at a premium membership, which is $249 a year, you also get access to both my CCRN and PCCN review courses. So I hope you enjoyed the question. I hope you have a very blessed day, and I'll see you again tomorrow. Bye-bye.